let us know when it's filming.
Okay. Yeah, it's filming.
Dr. Vagt, West Point graduate, Doctor of Chiropractic, specializing in applied kinesiology. What the heck is neurointegration?
I want to thank you, Mike, for asking me that question. You come down here.
Wait a minute, you paid me to do it.
You volunteered on your day off to be in the middle between me and the world trying to figure out what neurointegration is.
That's correct.
Okay. Neurointegration is a term that I've coined to describe the process I use that I've developed from applied kinesiology to help get people organized, their nervous system organized, so that whatever's bothering them or paining them in their life goes away and their body functions and they function the way they want to be. Okay?
Okay, so many of the people out there know about acupuncture and acupressure and how something in your foot relates to something in your
Right.
liver or heart or whatever. Is that what you're getting at, except for your nervous system? Is that kind of the same thing, or is that
Okay. Each one of those are pieces. Neurointegration takes all the pieces and puts it into one great big picture. It'd be like having a jigsaw puzzle. If you're looking at the human body as a jigsaw puzzle of 4 pieces, I've kept adding pieces to it, so it's now an infinite size jigsaw puzzle. All the pieces that it needs that apply to the person that will help them, I've kept expanding the scope how I look through them and expanding it out to get to see the problem. It's like if you look through something with a straw, you would see what it is, and if that was a problem, without seeing everything around it, you might not be able to get the problem.
okay? So it's like you need to see the whole picture, not just the particulates. In other words, when you're growing up, learning, studying, if you just learn the minutia, you really don't see the big picture. Is that right? Is that what you're saying? If you just concentrate on the one little thing,
Okay.
like through the straw. So
Right. Okay.
So when you work with somebody,
I think I understand what you're trying to say. You got to be able to see the details,
right?
but you got to be able to back up and see them a big enough picture to see how they all fit together.
Right.
Because a TV screen is nothing but a bunch of dots.
Right.
So if you were watching those dots go by, you wouldn't notice anything. You back up far enough, you can see how it all fits together.
Right.
And that's what neurointegration does, but not. It's not looking at it from the outside.
Okay.
It's coming from the inside, looking into details from the inside of this container.
So
And that's what muscle testing lets me, and if you're the patient, do. There's you and there's me, but we have your body. And through applied kinesiology muscle testing, we can access your body to get a sense of what's going on inside of it. While at the same time, I question you so you can give me answers of what you're, not what you think about or anything like this, but how you experience it. And from that, I'm able to zero in on where the problem is. And then from that, actually putting myself in that place, I start to talk to you about what the problem is. And you go, yeah, that's it, that fits. Okay? This scares some people. Other people are so happy. I finally am talking to somebody that understands what I'm saying. And you can tell on other people's face, by the look on their face, how did you know that? Because they're trying to hide it. Or they don't want to deal, whatever.
they don't want to deal with it.
They don't want to deal with it, they don't want to see it. And it scares them. You can just see the look on their face. They're going, okay.
So when you use this neurointegration, you're actually on I gather from what you said, you're on a mission to improve that person's physical body, mental situation, perhaps mental stability, and health, I would guess.
Anything.
Yeah.
If they've got a problem, they come to me. My challenge is if they've got a problem and they present it to me, they come to me to help them with it or fix it. Okay? I have developed a reputation. Nobody else can figure out what's going on with you. Go see Lee.
Exactly.
And then I have patients come in that knew me. They go, why did I go to these 4 other people trying to figure out this? Why did I just come to you to start with?
Right.
Because my job is to connect with the person to find out what their problem is.
Okay, so you're connecting with them, you're asking them questions, you're muscle testing, as you say.
Right?
Where that leads you to make observations about them, like you said. Now, then what do you do? What does neurointegration provide to the patient or to the person?
Okay.
I mean, we know the object is by finding things out.
Right. I know what the object is. Then it depends on the patient. If it's some patient that I've never seen before and they're first coming in, that's one process. It's trying to unpeel the onion to figure out what their specific thing is going. Then you've got patients like you that have seen me and we're working on this, and in your case, I'm going to make a guess here, is you're just not really coming into me just because you're in pain or symptomatic relief. You've got that, but you're trying to evolve and you're trying to grow. And then there is what is neurointegration to me, who's developed this from the inside out over the last 25 years. That's a whole different concept, okay? So just so I don't confuse everybody too much, we're going to back up here.
Okay.
Okay. I don't know how far to back up.
Well,
So,
when I first started going to you,
right,
you were a chiropractor and becoming a kinesiologist. So we did a lot of manipulations and things like that. Through the years, you do manipulation if I
Right.
need it, but we have discovered causes that when I tell my friends about, you found this out and my pain went away through talk and potions and witch doctory or whatever you want to call it.
okay, yeah.
Is that what you're talking about? That we need to get? Is that where we're going?
I think that would be helpful to clarify this, okay? Neurointegration really got going when over 25 years ago, a therapist came to me with a group of patients, whatever they call them, that she had, clients, that were diagnosed borderline personality disorder. She knew from a mutual friend that I worked on limbic systems. She was sure the limbic system was their problem, and she was dead on. Okay? So I volunteered to work with it. I had no idea what a borderline personality was, but I did know that I could work with the limbic system, and using the muscle test in the body, we could unravel this with everybody's cooperation. So that's where it started. And what I found out with people that are borderline personality disorder is their system is disintegrated. It's come apart. They're not integrated. Their nervous system is not together. And by working on things with their body through muscle testing to find out what they needed to get their system just back together, they felt different. The therapist said they were different. But the most amazing thing was people that didn't even know anything was going on would come up to and ask them, what's going on? You're different. People would tell. And what would happen with that is then I would get them as patients because they saw the change in this person. So that's where it started. Okay. Then, in my desire to learn more about that, I was convinced to go to an experiential workshop. Experiential workshop is not talk, it's experience, it's based in experience. That has basically been my foundation my whole life. Based in experience, what works in physical right now. And that's basically what this whole approach is based in. It's got to work right now, practical application in the world for your experience to change. So I'm at this experiential workshop. The lady that's giving it really respects what I do. She wants me to tell these people what I do. And there's maybe 10 or 15, I'm not sure back then. But this was 3 or 4 days into this workshop. So I was perfectly comfortable with all these people. And I go, it's great. I want to be famous. She's going to introduce me to the world. This is great. Few minutes, maybe 10, 15 minutes, something like that, before it was my turn to start talking, my palms start sweating. Then my heart starts racing. And then, deep down inside of me, this terror. I mean terror. I'm not talking about fear. I'm not talking about panic. I know what those two are. This was terror. And I'm looking down at it from in here going, what the blankety blank is this? But it was coming out of me, okay? I fooled the people by saying, well, I'm just a little nervous, haven't presented before. And also, they all assured me, so everything was fine. But I'm going, what is that? And at that moment, I no longer was a doctor treating people with borderline personality disorder and disintegration. A part of me was disintegrated. So I now had to get inside of it, from the inside, to start to save myself, save whatever that was. After that workshop, there was a feeling in my chest. And I kept explaining it to people, because I wasn't too much into feelings and all this stuff. And they'd go, is it this? And I'd go, no. And they kept doing this for over a week. Could not get it that matched. So I love to hunt. I love Mother Nature. I'm out there hunting. Well, I'm acting like I'm hunting, but I'm actually just trying to grok what this is, get in touch with this. And I'm walking along, and I start to get the sense in my body that my bladder's starting to get full, that I need to urinate, and I go, that's what I was feeling there. That feeling when your bladder starts to get fuller. It just starts to expand a little bit. It was no feeling in my heart, a feeling, quote feeling. It was a sense of that expansion. My heart was literally expanding. So that's when the heart got into this. And over time, piece by piece, has been added to this to keep expanding the picture. And I use the analogy of a jigsaw puzzle. This is your own jigsaw puzzle. You've got all the pieces are in there. You've got to find the piece, turn them over, and get them to fit. But each time you put it together, your sense picture of yourself from the inside starts to grow. And it just keeps expanding. So, where this is expanded to now, when I try to explain this to people, I use my little training aid. Okay. Applied kinesiology used a symbol of an equilateral triangle. It was two-dimensional. It had 3 sides: physical, mental, emotional, and chemical. By the time I got into this, making this 3-dimensional was the only thing that would work. I had to add another dimension, which was spiritual, that turned it into an equilateral triangle, completely stable, and the heart is at the center. This was my working model, trying to come up with something that would match the experience and sense I had inside of me. Okay? And I'm not sure when actually the soul came in. But in this process, I discovered my soul. No, I didn't really discover my soul. There was no doubt I had a soul. But how to get the soul to fit into this model of a human being that's fully developed, I realized the soul had to get into the heart. Because a lot of this work, in order to get to the root of this whole thing, we ended up having to work. I know we worked in the dark. Maybe I even put you in a fetal position. It goes back really early to around conception. Then a couple of 3 years ago, it's hard to tell now, there was still something that was missing. And I knew it was spiritual. And that's when I discovered the spirit I realized it was just spirit in me. Spirit comes in with the first breath. Fetuses don't breathe at all. It's actually born when the first breath comes in. And that's the last breath that leaves. And the spirit then had to be the other piece that had to get into the heart. Okay? So they could be complete. And you've heard of the concept of soulmate? Well, guess who your soul's mate is?
Your spirit.
Exactly.
Well,
And who's,
you already taught me that.
well, at least you paid attention. And who's the spirit's mate? The soul. They're both essences love, and the only organ in the body of love that really can handle this is not on either end of the spine. Okay? It's the heart. So then, and I'm trying to be a human being. Okay? I'm trying to be a human being, which is the total integration of this. So then you back up further, trying to figure out where the soul and spirit came from. Okay? As far as I'm concerned, God is the source of everything here on earth. It can either come to me directly, which would be my soul and my spirit, or it can come indirectly to the world. My source of God, when I grew up, because I lived in nature with a dog, was the world, but not with people. It was Mother Nature. These two have to come together to form us. Actually, we're going to do this a little there. Okay. Out of the world comes two parts: a soul, a spirit. Not a spirit, not a soul. Out of the world comes the sperm. Starts with S, different word. Sperm and the egg. Those two in duality come together in the heart. The soul and the spirit in duality come together in the heart, because this reality is duality. It takes two to make one. You can't make a human being out of a sperm or an egg. The union of them makes what can become the human being. The whole object is to get both sources from God to come together, totally in here, that comes together and creates a new thing that's a human being. That's the integration union of all of this. It's like hydrogen and oxygen come together, they make water. Water, which we're mostly water here anyway, is not hydrogen, nor is it oxygen, and it's not like either one of them, but without either one of them in that union, we don't get water. Now that's a short answer.
Okay. So, if I'm out there listening to this, I'm going, well, okay, that's all well and good, but what's the manifestation of this? How do I know that this is right? Is it because whenever people say their heart's broken, they feel like their heart is really broken? Because the heart's an organ. An atheist is going to say to you, well, God, what's, but organs are organs, right? And I'm going to answer my question a little bit for you, is what I just said, is people do say their heart's broken.
Right, I understand.
And they do,
Right.
and they
Right.
feel that.
Oh yes.
So what you're saying to me makes sense, because whether you believe in a God or not, the organs are themselves do manifestate your feelings. I mean, are you?
Right, and we use those expressions all the time.
Exactly.
Okay.
And I have a little advantage over the listener because I have experienced this through you in my own life. From early on when we first got together, and you did stuff that helped me play basketball after I'd sprained my ankle in the morning, and I played that night. So I believe.
Because you've had experience.
I've had experience.
Right.
Are you the only one doing this? Are there other people that are starting to get into this? Are you training other people? How do the people out there listening? How can they experience it?
Okay. That's a challenge right now. Because if you remember earlier on, I told you about that terror piece that was in terror. It's taken me this long to get it to a place that's the opposite extreme of that terror, where it is okay and wholeheartedly into this, heart and soul and everything, into actually putting this video out. That's part of it. I have patients who, with no formal training, I've done enough this process over and over with them, they are doing it with themselves or on some other family members. This is not, I'm going to say this, this is not something that I have that nobody else can do. This is, to me, this is just the fullest manifestation of being a human being, to have these capacities and capabilities, to self-correct and self-heal. Okay? So I'm not sure if that sort of answers your question, sort of doesn't answer your question.
Well, in effect, what you're saying is that people like me who experience this through you oftentimes go on to help family members, etc., with similar type things.
Right.
So it is getting out there.
Yes.
Now, you didn't go to somebody in New York and learn this, or in San Francisco. So this is something that you've really basically started, and if somebody else is doing it, it's because they got there the same way you got there.
Well, look.
And we don't know that they're doing it.
Right, don't know that they're doing it, and all I've been trying to do is totally improve, keep improving, find a better way, find a more exact way for me to be a whole human being. And my patients want, a lot of them want the same thing, so they're guinea pigs. They let me practice on them. I've got signed releases.
Well, that's what doctors do. They practice.
And they have liked what they've seen, okay? So we keep working on it, and their feedback about what it is gives me a bigger picture of what's going on, and not just my path, my individual path. There is no path. There is no path. If you've ever been out in the woods and you're walking, there is no path when you go in virgin territory. And your life has not been lived before, there is no path. If you're on a path, somebody else made it. Okay? There is no path to this thing. And this is part of my challenge. Is in one case, which really, I've had to do this on my own by myself, with help and my body's help. That's without my body, I'd have never done this. Actually, without muscle testing and being able to access my body, I'd have never come. I would not even have attempted this insanity. Okay. But with that help, I've been able to trial and error to get this to function this way, and get it to function in other people, and see other people be able to get it to function in somebody else. So I know this is just not something, some magic potion I have, or some special thing. So I'm not sure where I was going with this.
Well, I think basically you answered the question that I had. But okay, so having experienced some of this, I know that you have a big, huge chart in your office, and there are like potions and elixirs and things like that go along with it. So,
right?
Is that part of the neurointegration, or is that bigger than that?
Neurointegration doesn't leave anything out. What we've been mostly talking about here is how to get us to manifest as a human being.
Yeah.
This, for lack of a better term, the non-physical aspect of getting to yourself. But being that if you're a human being, you're body-based, if the body doesn't work up to its optimum, your ability to manifest any of this other stuff is severely limited.
Okay, so that goes back to your people with borderline.
Right.
They may have a vitamin deficiency.
Yes,
for
it
example.
can be.
Yeah.
And it does with a lot of people, because the chemical side gets off.
And we know this,
Yes.
not from what you're saying, but from, I mean, that's pretty much accepted throughout in the holistic medicine and in real,
Right, I guess
conventional.
Shut up.
Okay.
The challenge is, there might be 100 things that could help your symptom. And every one of them's worked, and every one proved to work. Only trouble is, how do you find the one that matches your symptoms? And that's where the body comes in. I didn't start off with all this stuff on my wall, But by testing people, say you got a B6 deficiency, and they come back a week later and they still got a B6 deficiency, I'm going, you take your B6? Yes. And find out the B6 they were taking didn't work in their body. Why, I don't know, but it just doesn't work. So I test it specifically. You got to get the specific. You got to get down to that little detail that fixes that specific problem, then see how the whole system works. And you've got to match it to the person. That's the whole thing. And that's where without this body, without being tuned into your body and using the body to navigate through this, you're lost. I mean, worse than lost. You're lost, then frustrated, then depressed, and you don't even want to try anymore.
Okay, and there's a lot of people out there that are probably feeling that right now.
Right.
Hopefully they're watching this. What can they do?
See, you're supposed to ask me questions that I have answers for.
I know you don't have
We
answers for it.
rehearsed this.
No, we didn't.
No, we didn't.
You didn't
What
want
can they
to.
do? What
Okay,
can they do?
what is there? I mean, because we're going to put this out there.
Right, okay? Part of this is, there's very few books that I have read. And I don't read them because the information the person's putting out drives me up a wall because it just doesn't match where I am. And I found just by finding certain books, Conversation with God is one of them, Shambhala, The Path of the Warrior is another one. Reading these books over and over and over again, what happened? You got a problem?
No, I zoomed in
Okay.
on the books. Yeah.
See, I was paying attention to the cameraman when he knows what he's doing. I'm the one that's lost here.
Well, we're human beings.
But why I wanted what these books is, when I read them, they resonated in me, within me, and I realized it was in my heart that that's accurate, that's true, that's helpful. And so, if I can read one of these and have that resonate and find that be truth and help me, then even just listening to this and going, that matches, or it scares you to death, either way. But if it matches, you go, there's some truth in here. And I'm doing a video for one reason. I explain this to my patients each time, and they sit there with this look on their face at the end, and they go, that makes sense. Don't ask me a question about it, or will I remember in 2 minutes, but it makes sense right now. So they can go over this. So I won't have to keep repeating myself over and over and over again. Okay?
Okay, so this video is for your patients and
Anybody.
Anybody.
To give, okay, this makes sense to me. This fits. This gives me another clue to this jigsaw puzzle. This, okay? Because I am not what would be classified as a spiritual being. I am not what would be classified as a physical being. I am a human being. The union of those two. The all-inclusive awareness, the all-inclusive consciousness, the whole thing of those two. Not just from a spiritual perspective, and not from a physical perspective, but a human perspective. And that's like looking at the world from the perspective of water versus hydrogen or oxygen. You're going to get a totally different perspective of the thing and miss the wonders of water if you're looking at it from hydrogen perspective. Okay?
so. What if you were talking to anybody that's listening? You know, one
If
on
I
one.
was talking to
When you are talking to people,
Okay.
one to one.
Right, one to one.
What can you give them advice on how to start neurointegration themselves? Or I mean, that's
Okay.
probably not a good question, but
Well,
I'm
I have a policy. Any question is a fair question, as long as you let me answer the question. So that's a fair question. The challenge is for me how to answer it and give an answer that's actually useful. I had not considered past the point of just being able to actually do this, what was going to happen next. Because my goal was to get that peace and terror into a place that would actually say this. Not know exactly what has to happen afterwards. You can Google me. I've got a website with I got an email address that's my first and last name at pacific.net. I hardly use email, but if you email and got a question, I'll answer your question. So I haven't got a good answer. I have not gone that far.
Well, I understand, but I'm trying to go where they're going to go. You know, where the listener's going to go. And I'm doing that because I have experienced valuable help from you with neurointegration.
Okay. Here's one thing I can do, and I do with a lot of patients, is that they can call me, and we can discuss and talk about things over the phone. Just like this. It's a lot better in person, but because I can pick up a lot more. But by able to question and a lot of times when you zero into something, it's pretty, that's helpful. And I have a lot of patients that have seen me one time, and then from then on, we're over the phone.
Yeah.
We can do this part over the phone. Okay? So I'm stumbling here to come up with an answer that's as good an answer as I got.
Okay, because part of what you do with me is muscle testing.
Right.
And that's a hands-on thing.
Right.
I'm assuming, since you're really the only applied kinesiologist I know, that's part of applied kinesiology is muscle testing. Is that correct?
That's correct. Muscle testing is part of applied kinesiology. That's correct.
So if listeners out there have gone to another applied kinesiologist person, they would know what we're talking about in terms of you can test me and find out that my liver's not functioning correctly.
Correct.
I mean, I'm not dying or anything like that. I just need to rebalance my liver, which we've done.
They can, yes, they can do that.
So those people out there who have done that can maybe better understand how you get to where you're at when you're in person.
Right.
So on the phone or through email or through other activities, you might be able to advise them on what to do with an applied kinesiologist, perhaps. So
I might be, yes, okay? The part of this that's my driving force is not what we just discussed. Discussed.
Okay.
My impetus, has been that panic part of my being to get it out of here. And I don't know of anybody else that does this whole thing
No, I
with
understand.
that intention. So that has been my crusade, my driving force, is to get that, to save, rescue, reintegrate that part of my soul and spirit or whatever back into the wholeness from which they came, to get that back together so the person from that core can start to put their life together.
So
Okay.
the purpose of this interview is basically has been to help you, help other people perhaps in the long run.
Right.
So where do you want this to go from here? What do you want to happen from here? If anything.
Well, like I said, I could not see past. Okay.
Mm-hmm.
Now, in the big picture, there is this wanting to be known for what I truly am, and that be put out in the world. And that's part of it. Okay?
And
I want people to know what's available. I'm here, I'm available with this. If they're interested, I'll help them.
there you go.
Okay, that's, okay,
See, that's when I came in here and agreed to do this with you,
right?
is because you have been helping me and have helped me for 30 years, and we've advanced, like I said earlier. I want other people to know what you can do. I understand that it comes from the fact that you had this terror and started, because we had that conversation
Right.
years ago.
We've had several conversations.
And it's an ongoing process.
Right.
This is because anybody that walks around in this world And a thinker knows that things happen daily that cause trauma, etc. And that's where you've helped me,
Right.
like the death of a friend and things like that.
Right. So here's the part that came to mind now, that since you said that, is what this does. So I am now going to talk from within me, where this has gotten me. Not only me, but a lot of other people. I was in a hurricane in the mid-70s. Inside the hurricane, when it passes right over the eye cover, it's peaceful and calm. Strange but true. That is the best natural phenomena that matches this, when the soul and the spirit and all of that consciousness is in the center of that heart, in that eye. Because that power creates this circular motion. That's a natural motion that lets you be in the world, that pureness be in the world, but not affected by it. So that I've got that down in the center of my being. Okay? They say that life is a circle. You go around and around and around in a circle. That's a circle. And I know I've been on that circle. And if you're going around this way in a circle and running it, you only got to run it up here. You got two ways to go on your path when life's a circle. When you make this go from a two-dimensional circle, make it three-dimensional, which this reality is, you get a sphere, which leaves you can keep going in circles, but you got infinite different movements that you can make. There's not just forward or back. Now, this works really good for an analogy, because when all of that comes in here gets concentrated at the dot in the center of this sphere, of this being, and starts to expand out from there, in alignment with that truth there, the I gets bigger and bigger and bigger and bigger and bigger. And on the inside of that I is like being in an IMAX theater where you got the surround sound, only it's a spherical. And your consciousness, your awareness is dead center in the center of that. And all